This is a second test diagnostic paper for long COVID. In this paper, the authors looked at blood plasma, specifically the platelets in the blood and then the fibrinaloid microclots. As they had seen high fibrin microclots in ME/CFS patients, a high degree of overlap between these patients and long COVID patients, they figured that this might be a good target for helping to diagnose long COVID, as these microclots can temporarily block the microcapillaries and hence create ischemia. In lack of tissue oxygenation, ME/CFS is myalgic encephalomyelitis combined with chronic fatigue syndrome, where symptoms include chronic fatigue, very poor sleep, joint and muscle pain, headaches, GI issues, flu-like symptoms, and cognitive impairments. With COVID-19, there's a high degree of overlap between ME/CFS and those patients being given the diagnosis of long COVID or post-acute sequela. And the authors of this study have previously shown that long COVID produces fibrin microclots and hyperactivated platelets. In the study, there's 25 patients with ME/CFS and 15 healthy participants. Interestingly, there is no discernible influence on vaccination status on the percent area of fibrin microclots within the two groups, meaning this will still occur if you get long COVID. This is what the clotting looks like in healthy individuals, and on here is what it looks like in ME/CFS patients, where you have lots of activated clotting and lots of fibrous microclots, in addition to platelets that are widespread and also tend to clump around the virus. So again, the authors wanted to show that the blood plasma in long COVID patients produces microclots and very active platelets, and they show that this did not occur in healthy individuals, as we just saw in those fluorescent images. And in the author's previous paper, there's an even greater degree of fibrous microclotting than what we saw here in this study. So in conclusion, the fibrin microclots and the associated coagulation issues are good markers of long COVID. However, again, long COVID produces way more of it, and therefore we have to be quite careful when considering anticoagulation therapy.